If your cat is drooling and doing this one thing, this is an emergency. If they're drooling and still eating normally, you can probably relax. I'm going to show you exactly how to tell the difference in the next 60 seconds. But first, we need to kill a myth. Most people assume cat drooling is like dog drooling. Messy, maybe a little gross, but basically harmless. Your neighbor's golden retriever soaks everything in sight and nobody panics. So when your cat starts drooling, you figure it's the same thing. It's not. Unlike dogs, cats rarely drool without reason. New or sudden drooling in your cat is almost always indicating something worth investigating. Dogs have evolved to drool constantly during excitement, heat, or just staring at dinner. Cats, their bodies aren't wired that way. So if your cat is suddenly drooling and they've never done this before, your instinct to pay attention is correct. But here's where it gets interesting, and where most cat owners get confused. Your cat doesn't have one type of drool, they have two. And which type they're producing tells you exactly what's happening inside their body. By the end of this video, you'll know the difference between happy drool and sick drool, and you'll have a simple framework to diagnose your cat's situation in under a minute. Let's start with the biology, because once you understand the mechanism, the diagnosis becomes obvious. Your cat has 5 major salivary glands. That's standard mammal equipment. But here's something most people don't know. One of those glands, the molar gland, is unique to cats. Dogs don't have it, humans don't have it, only cats. This matters because it means your cat's drool carries different information than a dog's drool. The systems controlling saliva production in cats are exquisitely tuned to respond to specific triggers. Here's the key insight. Your cat's salivary glands are controlled by 2 separate nervous systems. The parasympathetic system, that's the rest and digest system. It produces thin, watery saliva during eating and relaxation. And the sympathetic system, fight or flight, that produces thicker, stringy, mucus-like saliva during stress or illness. Think of it like your cat's body running 2 different programs. The relaxation program makes watery drool, the alarm program makes thick drool. Same glands, completely different outputs. This is why context matters so much. If your cat is kneading in your lap, purring and producing thin, watery drool, that's the relaxation program running. Veterinary experts theorize that endorphins released during purring and kneading stimulate the salivary glands, and deeply relaxed cats simply forget to swallow. This is contentment drooling. It's not just normal, it's a sign your cat is genuinely happy. But if your cat is producing thick, ropey saliva while hiding under the bed or refusing food, that's the alarm program. Your cat's body is signaling that something is wrong. Now here's where dental disease enters the picture, and why it's the single most important cause of pathological drooling in cats. According to AAHA dental care guidelines, by age 3, most cats show early evidence of periodontal disease. The Cornell Feline Health Center reports that cats with periodontitis, that's advanced gum disease, may drool, turn their heads to the side when chewing, and develop bad breath. But there's a condition even more severe, FCGS, feline chronic gingivostomitis. It's an immune-mediated oral inflammatory disease that causes intense burning pain in your cat's mouth. 2023 research shows that about 70 to 80% of cats with this disease show substantial improvement following dental extraction therapy, taking their teeth out. For some cats, removing all their teeth sounds extreme, but is often the path to a pain-free life. Alright, if this is clicking for you, hit subscribe. We decode cat behavior every week using the actual science. Now let's give you something you can use right now. I'm going to walk you through exactly how to diagnose your cat's drooling, and more importantly, when to act. First, the Happy Drool Test. Ask yourself 3 questions. 1. Does the drooling only happen during kneading, purring, or being petted? 2. Does it stop when the activity stops? 3. Is your cat eating normally, playing, and behaving normally otherwise? If all 3 answers are yes, you have a happy drooler. Congratulations, your cat loves you so much they forgot to swallow. If any answer is no, keep investigating. Here's the emergency checklist. These combinations mean go to the vet now. Drooling plus difficulty breathing, drooling plus seizures or collapse, drooling plus facial swelling, drooling after known toxic exposure, cleaning products, certain plants, anything your cat ate that they shouldn't have. According to Cornell Feline Health Center, uncharacteristic sluggishness, unsteady gait, drooling, heavy breathing, and seizures are common signs of feline poisoning. Don't wait, don't Google more, go. Here's what requires a vet visit within 24 to 48 hours. Blood in the saliva, new drooling lasting more than 24 hours, drooling combined with refusing food, and drooling with lethargy or unusual hiding. Now, the texture of the drool itself gives you clues. Thick, stringy drool combined with bad breath and head tilting when eating usually points to dental disease. Clear, watery drool with lip licking and turning away from food suggests nausea. Your cat's body is telling you which system is activated. And one more thing, and this is important. Certain houseplants cause immediate drooling because they contain calcium oxalate crystals that burn your cat's mouth on contact. Philodendrons and Schefflera are common culprits. If your cat is chewing on a plant and started drooling immediately, that's likely the cause. But watch for worsening symptoms and call your vet or poison control if you're unsure. So let's circle back to where we started. Is your cat drooling an emergency or can you relax? You now know the answer depends on two things: the type of drool and what accompanies it. Thin, watery drool during happy activities with no other symptoms, your cat is fine, they're just really into you. Thick drool, any drool with other symptoms or drool that persists, it's time to investigate. Check the teeth, check for toxins, and when in doubt, call your vet. Unlike dogs who drool as a lifestyle, every drop from your cat's mouth carries meaning. Now you know how to read it. If you want to go deeper into cat health, check out our other videos and subscribe. Thanks for watching.